30,000 for Coventry and about...
I understand. I just
Okay.
want to know where we got that number, because my understanding is the CBIZ did not give us that number.
No, they did not.
So we got it from NPR. So I guess, did CBIZ come in and say, we can bid this out, but there are other options for you as far as tailoring a plan that meets your needs better?
No, they did not.
And why didn't we ask that question?
Because we asked to go out, our direction was to go out and bid our plan, and for them to bid the plan to look apples to apples. These were the plans we had, and that's what they went out to bid.
I mean, but so this, in this snapshot case of $1,500 and $3,000 deductibles for the high deductible plan, NPR wins. But what would be the case if we adjusted those rates or those deductibles to $2,500 and $5,000? We have no idea whether NPR would still be competitive or not.
Well, and NPR doesn't have that plan. So to, again, look at trying to determine what our plan is, apples to apples, we gave them all the plans, and they had them, and asked them to go to bid for similar plans.
And really, that's the problem, as I see it, with NPR, which is you get a couple choices, whereas if you go with CBIZ, they can tailor-make a plan that fits everybody's needs, both on cost.
Sure, you can tailor-make anything.
But not at NPR.
Not with NPR.
But that wasn't the direction that council provided, is that correct?
That's
Back to
what
your
it's
apples to apple comment.
Well, I mean, actually,
Right.
the original committee direction was that we were going to talk about all aspects of it. And I guess it was just assumed that that would be the case after we decided to let staff handle it. But somehow I think it got lost in the translation that, you know, this was all we were doing, is getting a competitive bid. And I guess my point is, and I made this point, you know, last summer, and that is that the biggest, the most attractive plan is not, in a high deductible plan at least, is not the $1,500 to $3,000 deductible. It's the greater deductible gives you a more, you know, bigger bang for the buck in allowing employees to put away more money because they don't have to spend as much on the high deductible plan, and it offers a lower premium for the city. And I guess that's a concern I have with continuing with NPR, is we don't get that option. We can't go to a $2,500, $5,000 deductible. That's the plan that CBIZ offers the school district with Coventry. And you know, I guess if we asked them, they might say the same thing would be available to us. So how did we get the information for the employee health data?
I'm sorry, I don't know what you're asking.
Where did CBIZ get their information? I understand that Midwest Public Risk can look at past claims. They have more knowledge than anybody on what the past claims are.
Yeah, that's correct. Midwest Public Risk does not do their rates based on the City of Gardner's claims data. It's the pool as a whole. So let's clarify that.
So everybody pays the same then? Every pool member in the pool pays the same rate?
That's correct. That's correct.
Okay.
That's what a pool does. You pay the same rate. CBIZ sent huge detailed reports that we had to complete based on what we know, and I cannot share some of this, and I'm going to tell you why, because I am required by law to protect employees by HIPAA rights.
By name?
I am required by law to protect employees' HIPAA rights. And I provided to to CBIZ what I knew of the questions they asked that we have in our employee base. And provided, based on that data, was what they sent out to the carriers.
So where did you get your information then? Is this information?
I work with employees, sir, on their health and their insurance and FMLA, and this was firsthand knowledge. That's my job.
So you get a report from NPR?
I do not get a report from NPR.
Every time an employee goes to the doctor, how do you...
Again, they didn't ask for everything. They asked for known things. What type of chronic ongoing illnesses are you aware of? Are you aware of cancers? Are you aware of diabetes? Are you aware of... These are chronic illnesses. And if I'm aware of those, I had to list that we had those conditions in our employee base.
And so, and you provided that in a written document?
Yes,
What about Form Fire? Did you use that?
no, that was not available to us.
Why not?
They said it was not available to us.
It says in their bid, this
I
will be
understand that,
accomplished-
but they came back, Mr. Fodovich, and told us that was not available, that these were the forms. I provided everything to them that they requested of the city of Gardner, and we turned it around in 24 hours to them.
I know, but I guess, did they lower their bid from $7,500? I mean, there's costs
We
involved.
actually are still talking with them about that, because we have a couple of options of how they might be compensated. You'll notice in the proposal, one of them was to look at $7,500. The other one is to look at a percentage of the premium, depending on what services they might provide for us in the future. And they actually proposed that, and one of the things we talked about was we needed to really get a feel for where we're going with health insurance before we commit to paying a percentage of the premiums. So we have not been invoiced for that. They're really waiting to see kind of what our decision point is for the final payment.
But you have to admit, Form Fire asks a lot more questions than what you probably...
I'm sorry, I'm not familiar with Form Fire. I mean,
When we met with CBiz, they talked about the schedule and the kind of information they needed, and they also talked to the providers about what they wanted from the city of Gardner to be able to quote us. The rates that we received, if we elect tonight to terminate the agreement with NPR, these are the rates that the carriers will be committed to providing us insurance for.
So these rates were based on 65-ish, roughly, 65 people who went with the high deductible plan, and then
they were
another
based
22.
on all the employees that are enrolled in our plan and the information that's known to us. We don't know everything that's going on in every family, with every spouse, with every dependent. All we can provide is what we know. So there will be more out there. And so next year, when we go to get renewal and they have claims data, we'll have to be able to address those things. Those are unknowns, and we do not have that information.
Right, but NPR is basing their quote on past claims.
Yes, which actually is good, because NPR is giving us a quote based on knowing exactly what the history is. So when you look at it, their quote is actually more reflective of what the risk truly is. So they know the risk when they quote it. If you think about it, the other companies who even quoted a higher number are quoting without having the detailed information. So it's really a better number to work with because they know exactly what they're underwriting.
But that's based on history, not the
That is
present.
very true.
And those are
it's-
two different things. You're looking at NPR's data, which is all history-based, and you're looking at CBiz's data, which is, I mean, from a history perspective, people could have left
Well,
City of
no,
Gardner.
no,
Their
we
health
quoted
insurance.
current, no, that we quote current employees. We don't quote people who are not here. And remember, the health situation of families changes. I mean, we could have someone's health situation that's changing right now. So they look at it each year to give you rates because the claims that they had last year may not be the claims they get next year because we don't know what may happen.
You know, I might just mention, because NPR has access to historical information, and then they still come in with the lowest quote, that should probably speak to wrapping this up.
And
Okay, anyway.
the pool quotes 10,000. The pool, when they're quoting and getting their numbers, they're getting it for 10,000 people. We're getting numbers for less than 100. It's going to be very, very challenging for us to get the same kind of discount from a health provider.
So last year, when we did the high deductible plan, we offered a one-time incentive for people to get on that plan. And is that going to continue this year?
I think that's a decision for the
That's
council to
probably a
make when we go
budget
into budget
decision.
discussions.
But if we don't offer it, then could it also be assumed that more people will not take that plan and will go to the higher cost plan.
Depends on what